A lot of babies are dying in front of our eyes. We cannot make anything to them. Really. Please stop this war. If you discharge him today, he will come tomorrow with cold injury or sepsis or pneumonia or severely dehydrated or even die.
A lot to unwrap here because this is a maternity hospital, as you can see, and these healthcare workers, you're dealing with the most vulnerable of vulnerable, right? Like premature babies or full-term newborn babies who need advanced medical care, who need the neonatal ICU, being born to mothers who are either malnourished, are not properly receiving medical treatment, which are then putting their babies at high risk, right? Imagine that they have gestational diabetes, gestational hypertension, any of these issues, plus many more. And these babies are also being compromised then in terms of their health and the care that they're receiving. This puts them then at risk for injury and, yes, sepsis, which is full body bloodstream infection.
Right now need mechanical ventilation, and there is no enough mechanical ventilation. As you see, all the mechanical ventilators are fully occupied. More than 2 to 3 patients in each incubator. The situation here is more than catastrophe.
Many of you who've worked in the NICU, nurses, pediatricians, residents, medical students, or if you're a parent who's ever had a child in the NICU, or you're an aunt who's ever visited a NICU, or a brother who's ever visited a NICU baby, then you recognize that having 2 to 3 babies in an isolate is not normal in any level NICU. This is not something that we would recommend, especially if they're not twins or triplets. And this is a very high-risk situation, especially because there's not enough mechanical ventilation for these infants either. So then you have doctors who are making decisions on literally which neonate, not even elderly citizen who's lived their life, you could say, neonate lives and which one dies because they don't have access to the ventilator. That is an extremely unsettling feeling. I can't imagine the moral injury that these physicians are going through. And you can hear it in his voice because these are infants that they are putting their life and soul into saving, who then they turn around and they're dead. Either a bomb has killed them, an injury has killed them, sepsis has killed them, hypothermia has killed them, dehydration has killed them, any of the above. These are really extreme circumstances that are being imposed upon the healthcare workers and their patients.
Emirati maternity hospital that caters for at least 83 deliveries a day, of which 15% of these deliveries are cesarean section. There is insufficient bed capacity for post-op care. Mothers are being discharged 6 hours post-operation to living conditions that do not meet the hygiene standards. That means lack of water, lack of sanitation facilities, lack of hygiene products for the mother and for the baby, and this exposes the newborn to a number of...
So you can imagine if you're a baby and you're not getting the adequate hygiene products like a diaper, skin infections, bacterial or fungal, can wreak havoc because you're not getting access to the appropriate resources you need, including medication. And the skin is the largest organ in the body. So yes, this can have devastating health impacts, especially if you're a child that is not properly nourished and their immune system therefore is not functioning the way it should be, as intended.
We cannot find even the food to support herself to feed her baby. The situation is more catastrophic.